Welcome to Breaking Point, a podcast from CAPC, the Center to Advance Palliative Care. In this limited series podcast, CAPC invites healthcare workers from across the country to share their eye-opening stories from the front lines of the pandemic. Listen as they give us an unfiltered look at their reactions to the demands they've encountered and the coping strategies they've employed as they reach their breaking point. Your host today is Dr. Andrew Esch.
Hi, everyone. I'm Andrew Esch. Thank you for joining us this week on Breaking Point. Today, we are joined by Dr. Sherika Newman, who is an Associate Medical Director for Vitas Healthcare in Atlanta, Georgia. She's CAPC faculty and a consultant. She's also my good friend. Sherika, thanks for being here today. How are you doing?
Thanks for having me. I'm pretty good. I can't complain.
I know, as we were getting prepared for this, I was thinking about it. The last time we saw each other in person was in 2019 in Atlanta. Is that right?
In Atlanta, before the pandemic, I took you to get ice cream in 30-degree weather and you didn't have a coat on. I felt so terrible. It was a terrible friend move, but I really wanted
it was good
to
ice cream though. Well, when we decided to do this podcast series, you immediately came to mind as a guest. The first reason for that was that, because we talk pretty much all the time, I know your pandemic story, or at least what you've told me of it, and it's a powerful one. So I think being able to share that with our audience is going to be really valuable to them. The second reason is you've never been one to shy away from telling things the way they are. And, that's what we're hoping to hear today. What's it been like for you? And, this has been a tough time for everyone, but, we want to get your story. So with that context, maybe you can share with our audience what like a typical day may have been like for you the last few years. Like what does a day with Sherika feel like and look like in the field?
I think it's very dynamic. I do believe things from the beginning of the pandemic have been very different than now. I mean, we're in our third year of a pandemic, and the very first year, especially those very first months, I would describe it as I feel like I'm in a twilight zone. Maybe I'm dating myself, and that's fine. But I felt like I was walking the halls kind of like in a zombie mode because everything was so foreign. I distinctly remember the first cold that I witnessed in the pandemic, and just how different it was from any other colds I had ever experienced. And the patient did not survive. And I remember the somberness in the atmosphere with all the staff, with me, not that we hadn't experienced a cold death, but that this was the first one on a COVID patient. We had to don before we went in. We forgot the backboard, just all those things that we in the medical field thought we had seamlessly down, right? Like we've coded since before residency as medical students, but the pandemic and COVID changed everything we did in just a normal process flow. And I just remember that evening sitting down saying, wow, like life is so different. The simple things that we took probably for granted is now slapping us in the face, and we see holes in processes that we didn't even know were there before.
Yeah. And things changed for you during the pandemic then too, because that first wave, I think for you in Atlanta was similar to everywhere else, where it was really affecting older and sort of vulnerable people. But maybe how did things change in your day-to-day when Delta came around, or that second wave came around and you started seeing younger people getting sick?
I think that probably had the greatest impact on the team, right? The first wave, the old people, you felt bad. I mean, we had this couple that died like hours apart. We did move heaven and earth to put them in the same room. And it's a different feeling when someone is at the end of their life and you at least feel they've lived a full life. But Delta changed the game. And I still say we cannot handle another Delta wave. I just don't think we could handle something like that as a medical system, as a healthcare system. We were getting, of course, people within your cohort, which is always difficult to deal with in palliative care when you see someone your age group dying. And so that's challenging, especially because Delta had no respective person. It did not necessarily attach itself to a higher risk factor for morbidity or mortality. It wasn't old people predominant anymore. It was young people, healthy 40-year-olds, and everyone wondering, like, what happened? Like, what turned this case around so quickly? And I think that became more of a burden on the team and impacted team health than the first wave, because we've always dealt with that in palliative care, but now the volume was drastically different. And that question mark of what happened was still lingering in the atmosphere. And so that kind of forced me as the director to do team health differently, right? Like, what do we do when everyone on the team is struggling at the same time?
Yeah, that combination of volume and then an age distribution that we're not used to, right? Like those really
it was complex.
Yeah.
That makes it complex, And we talk about complicated grief for patient and families, but I think we don't talk about it when it comes to us as clinicians. Like, to me, that's team grief, right? It's very complex, complicated grief as a team.
Yeah. I know it's so hard, having worked with you for years like we have, I know that the connection with patients and families is so important to your work, and that's, fuels your passion for palliative care. How did you handle, that combination of volume and then having to gown up and do all that stuff that puts barriers between you and patients? Like, how did that affect how you practice, having to see a high volume of patients in a very restrictive environment? That had to be, knowing you, that had to be hard for you.
That probably is the thorn in my side with the entire pandemic. You know me very well. And so I think it's unkind and unfair for people to die alone. I feel it's just inhumane. I really do. It's still such a painful thing for me to see, and knowing that a patient is experiencing it. When we had the no visitor policy and the medical team became the surrogate family members, that added like that extra layer of complexity to the care. The nurses were trying to be by bedside for people that were actively dying, to at least have, some hand holding or some human presence during a very tough process for a patient. We were videoing families on so they could say their goodbyes over teleprompters or Zoom or whatever, and it's not the same as being live or in person with your loved one. And so now there are a lot of hospitals that, like my hospital, is allowing even our COVID patients that have family there at end of life, which is phenomenal. Put them in PPE because there's no shortage, and it has made a big difference. But we still have families who, someone is home sick with COVID because they live in the same household, or they're too scared to come, or the like typical grief, like, I can't see my loved one suffer like this. So you still have those cases that burn, but it's not as terrible as the very beginning, or even during Delta when no visitors could come in. It feels unkind to me as a provider. And I know, we talk about population health or population management versus patient-centered care. And I know that's what we kind of leaped into with COVID. Like, it went overnight, right? From patient-centered care to population-centered care. And that transition, it was no time for us to build up to that. And I get it, but it doesn't take the sting away.
Yeah. So let's talk about that for a minute. What gets you through then? Like, not being able to practice in a way that probably drew you to palliative care in the first place, seeing everybody sort of tired, reliving this Groundhog Day over and over. Like, what brought you joy, or what helped you cope? What got you through? Or is getting you?
I think for me, I always do better when I can get it out, right? So I need to talk about it. I need to get it off my chest. I don't want to hold it in. And it's easier for me to do that with someone who understands. So that's why you get a lot of calls. Because it's easier to just say it, right? And not have to give a backstory, not have to get people to understand what's going on in medicine, not have to talk to someone who doesn't understand the numbers. Oh my God, I just want to get it out without having to bring you up to speed, right? So it's easier for me to just sit down with someone like you or my team, or sometimes even call my pastor who is not in the medical field at all, but she just gets it, right? So I have to talk with somebody to like unburden myself. Not that I want to burden them, but then it helps me come home and just like process. I feel less weight on me when I'm home. I don't still feel like I'm thinking about my day at work or thinking about how terrible it is, or at least it's less of them. I still bring stuff home, but it's not as many as I would bring home if I did not talk about it, or at least have someone to say, this sucks. We're still 3 years into this pandemic. I don't see an out. People are still dying. It's not fair. We still don't know what's going on. We know less than we know more. And I like all of that. I need to get out because it absolutely sucks.
Yeah. So what's maybe something you and your team did to help overcome that despair, if that's the right word, that we all are feeling in some ambient low level? Like, is there anything that was really successful for you and your staff and team that are helping you get through this, that maybe others could take and use it in their institution or with their team?
Well, I think one thing we did was start doing better, like having a period of time in the day where we all just come together, and most of the time it's lunch for us. Food brings people together like nothing else, right? So I think we would plan to meet each other for lunch, or someone would text and say food ? And we would all say yes, or after I see this patient, and we would wait on each other. And I gave, as the leader, my team permission to stop. Yes, the consultants are going to still come. Yes, the family's still going to have a need, and your consultants are still going to have needs, every stakeholder. But give yourself permission to time out and take a break away from it. Fresh eyes, fresh ears, fresh everything. And in that time frame, it also gives us time to do the decompression. Like, yeah, this case sucks. How can we help this family? What do you think about this? We always go back like to it's horrible. If it was us, we had this really, really challenging case during the pandemic that everyone was crying. The nurses, our team, everyone involved sat at the station and cried. And so I just gave my team after that, well, we're not running to the next case. We're going to give ourselves a pause to like check in with your emotions, check in with yourself, and make sure you are fortified to move forward. So I just think that, with all the team stuff, health stuff that we've learned at Fort Myers and through CAPC, I knew how to kind of keep my team rallied. And the key thing for me as a leader is to give them permission. And I got that from you. I like that you told us that at Fort Myers almost every meeting. Like, if we have a heavy case, emotionally heavy case, to take a break, go back to the office and kind of decompress and gather yourself. You don't have to just keep charging forward. And that's not something that we do a lot in medicine. I mean, in medicine, it's like high volume, keep going, leave your feelings at home and just get through the day. And I don't think we could sustain each other in palliative care. I think we would have a higher burnout rate if we didn't stop and let our emotions catch up with what's going on, and just instead of just moving forward. So I think the key thing that I did, and we still do, is to take a break. I mean, I brought the whole team lunch today. Well, it wasn't healthy, and I meant for it not to be healthy. It was pizza, Coke, and chocolate. I meant for it to be completely calorie loaded because I felt like that's what we needed because we had a very complex week. For the last 2 weeks, every single one of our hospice patients have been COVID, every single one. One was 42, one was 41, and it just was heavy for us. So I was like, we're going to have a day where we leave our cares at the door, where we eat completely unhealthy food. We're not counting our calories. This is all about comfort. We're palliating ourselves today with pizza, Coke, and chocolate. That's it.
That sounds pretty good. Well, it's funny you mentioned like their experience in Fort Myers and just giving yourself a pause. I remember the social workers we worked with there, Kate and Joy in particular, they they said, Andy, it's okay to go into a room, close the door behind you, and either bang your head against the wall or cry. Like that's like, that's normal.
That's normal. And I think we don't do it. I mean, I don't know if you know the book Kitchen Table Wisdom, but it has a lot of this kind of talk about it in just the medical field as a whole, not palliative care, about how somewhere down in history, we've been taught as practitioners and medical teams to not have emotions. And that's impossible. Something is going to prick you. I actually out myself all the time with my team because kids and Jamaican men are going to trigger me and prick me. I'm always going to feel something in my heart for that particular type of patient. And so I think to take the humanity out is the wrong thing to do. I think to go in a room after a tough case and cry, bang your head, whatever, is healthy.
Yeah.
And should be promoted, by the way. It should be promoted. There are some cases you and I had in Fort Myers where both of us, I mean, I remember after that one young girl, when we had the big family meeting, how you and I just sat in the room in quietness, because it's just a lot, and so you and I had looked at each other like we don't even know what else to do. Her pain was uncontrollable. You and I had done all the things that we needed to do and consulted people, and it was still uncontrolled. And we just sat there looking at each other like we are lost. And this is terrible because we really want to help and you can't.
Yeah. Yeah. The emotion in our work is hard to separate from the work itself, as much as we're trained to do so. I just want to touch on your advice about the team supporting each other and, pizza and chocolate and those things. Like what's your advice for people maybe listening to this podcast that aren't on a palliative care team, that don't have, I'll almost call it a luxury that we've had during the pandemic, because we've been able to lean on each other, right?
Right.
I just wonder how like the med-surg nurse or the, maybe hospitalist, I don't know if they share that same sense of team. What do you see that in your hospital, and what advice would you have for somebody who's not part of a palliative care team?
I probably don't see it in the nurses, but I do see it in some clinical fields that aren't team driven. That's probably a little bit more data driven. And I would encourage them to discover their own personal coping strategy, whether it is to have a team to talk to or a person to talk to, whether it's just, getting a massage or venting to the CEO, whatever that's healthy. I mean, we've seen an increase in anxiety, depression, and suicide during this pandemic, right? And drug abuse. So we have to develop some healthy coping mechanisms. And this is the time to do it. Whatever it takes is how I feel, because this is not stopping anytime soon. And you're either going to burn out or make a poor choice if you don't develop some type of coping mechanism, and not on a team where you could share it, right? Like we can share it with each other, share the burden of it. But some people, it's not in them to do. So if that's you, or you're on somewhere you don't have a team, you have to figure out for yourself what would keep you centered and balanced. Because being imbalanced and dysregulated is completely unhealthy. You make poor choices.
Is there anything within, and I don't want to get you in trouble here, so tiptoe around this one. Is there anything within like Vitas or the hospitals that you work in for them that has been done really well or really poorly that has struck you through the pandemic?
Well, I think what went really well at the very beginning, Piedmont, which is the hospital we're embedded in, had licensed therapists that were providing group and individual support to anyone in the hospital, ancillary clinical periods. And that was very helpful. I participated in some of the group sessions for that particular talk, and it changed because you realize you're not on an island, right? And no one wants to be on an island. And some of the things that we feel can easily go into shame, where you attach shame to it. It's not shameful in and of itself, but it feels like it should be shameful that you feel this way. I know one of the things, and hopefully this But I've had some doctors tell me that it's burdensome to treat the unvaccinated patient, because they made a choice that now has landed them in a bad situation. And that could be shameful, but the truth is, say it out loud so that we can all talk about it, because someone else may feel the same way, but then someone may not, who can offer you a different perspective. And I think that's the healthy thing to do. So that's what the group therapy did in those sessions very early on. And I think the bad thing is that they're not being offered now, right? Like, those things still need to be happening. I feel like we had all this healthcare hero stuff at the beginning that has now all gone away. And it's like they've kind of forgotten about us, but we're still in the thick of this. And it's like it was a fad or a buzz for a while, and now it's forgotten about. And I wish we could do that better as a nation, not just at an institution level.
Yep, agree. Yeah, the vaccination thing's a complicated one, right? Like,
I think it's such a sensitive topic. And I think it's a combination of burnout, though. Like, we're in our third year of something that no one in healthcare has ever faced or treated. And we're still learning new stuff every single day. If you try to keep up with the COVID information that's coming out, you could be overwhelmed just in that, all the new information that's coming out globally, right? Some stuff out of France, some stuff out of Italy, some stuff stateside. That's a lot to keep up with. And so to do that, still do patient care, and still have to take care of someone who made a poor choice, in your opinion, right? Like, as adults, we get to make poor choices, but it's different when your poor choice impacts us and then a system. So now what? And that's the, I guess, conundrum we're in, to me, right now. And I don't know if there is a particular fix. I don't think we can just, turn the light switch on and it goes away, but it's a real feeling. It's an authentic feeling that some people in healthcare have.
This darn pandemic, I'll tell you, we don't work in a perfect healthcare system by any means, right? We know that. But damn, Did this thing rip the scab off of everything that was wrong, right?
When I say exposed every hole that was in the system, made the known holes bigger, we knew implicit bias was there, right? Like, we knew we had a problem in healthcare with implicit bias, but the pandemic exposed it like wide open. And that's like, what do you do with that? Because that's a big gap to close. That's a big thing to work on. That's a systemic problem that can't be fixed overnight, but it's still affecting boots on the ground providers. And so now you have a stressed provider and a stressed system that doesn't see an end or doesn't see an ending. So I think this pandemic has brought about a change in positive and negative ways, but more than anything, it exposed us as America. It really exposed us. People didn't even understand what palliative care was. And then during the pandemic, everyone wants palliative care now, because they finally understand its utilization across every healthcare continuum, right? What we were already short-staffed, right? Our workforce in palliative care was already low. So now you have people wanting us more, but not enough of us in a more magnified way. And that's what the pandemic has done, put magnifying glasses on everything that had a hole in it and made it bigger. And we don't have a Band-Aid big enough for that.
No, we don't.
We ain't got a fix for that. So now what? Because of, like, us boots on the ground, we want you to come fix it, because we're like spinning our wheels a little bit. That whole situation, that's always been present, right, Andy, where there's that sandwich generation. I still have to work, but my loved one is sick. That's worse now, right? Because now the loved one is 40. I have the 40-year-old who really is hospice and dying, not appropriate to remain in the hospital, not IPU level care, but has no home to go to because her sister's working, her mother's taking care of the father, and now they don't have the money. So that thing got bigger. Nursing home care got ripped open because they shut down because of the COVID. Their COVID numbers are up. You can't go visit them. Loved ones. It just created these big holes where little ones used to be.
Yeah. I think, when this first started, I used to think, oh, I just want to go back to the way things were in 2019. But the truth is, it wasn't all that great then. And the longer this goes on and the deeper we get into it, I almost think, my rallying cry is maybe real change will come from this, because it has been so exposed as being
That's my
broken.
hope.
Yeah,
that's
right?
my hope. That's my, but my thing is that when that's not soon, right, Andy? Like, that's not coming to us within the next year. So what do you do with the stress providers, the stress people on the ground until then? Because that pressure is still there. Like, I cringe every time the family says they can't take the loved one home. They don't have money to pay for it. Because now it's more stories like that than what I had in 2019, right? But there's no fix. And you as a provider, especially when you are a palliative provider, where your focus is to comfort, right? Like, your whole mindset, your whole service line, you're driven by high quality. And now there is no way to provide high quality. There's no way to provide comfort to this patient and family. You are stuck. And you can't go around paying for everyone's caregiver out of your own pocket, right? So it's like, what do you do? Like, and this is just like a question out there. What do you do for the person who's still boots on the ground, but we're waiting on the system to change for the better? Like, what do you do in that segue in the meantime?
I think the things that you said worked for you, like when you had the counselors at Piedmont, at CAPC, we're trying to provide debriefings for the field, training people to bring debriefings back to their institutions. I think we have to support each other and be advocates for change. We can't, if Omicron sort of takes us into some smoldering endemic phase, let's not remember what this was like and get complacent again and be okay with going back to 2019 standards. I think, I think that's the call to arms, is to let's take care of each other to get through the worst of this. And let's not be okay with it going back to the way it was. Right.
Create some advocacy around healthcare providers and the needs of the healthcare provider. And the need, how that need impacts patient care. That's a good aim.
Yeah. I mean, I think we're all pretty tired to fight that fight right now, but I think taking care of ourselves, taking care of each other, then we could start getting mouthy, right?
Yeah. Because when I say we are all tired, that's why my hope and prayer is that we do not get another wave of like Delta, because Delta was just a beast. Omicron, we still got pretty good numbers in my hospital with Omicron, but it was not Delta. And so that's better than putting a terrible variant on a stress system, because it makes you at least feel like, okay, I can get through this. The wave may come again, but I can take the next waves that come along, and it won't drown me. I feel like if we get another Delta, we're going to drown as a system.
Well, Sherika, I want to thank you. This is great. I miss talking to you in person so much. 30-degree ice cream sounds great to me right now, because at least it's not through a computer screen. So,
right. I'll send you some pizza, chocolate, and Coke your way right now.
All right, that sounds good. Thanks so much, Sherika, okay. And thanks everyone.
You're welcome
for being with us today.
All right, have a good day.
Thank you for listening today. For debriefings, the emotional PPE toolkit, and more, visit capc.org/COVID-19.